Welcome to the Inspyre Effect.
Together we're going to unlock a path to a healthier pain for you.
My name is Leanne. I'm a nurse practitioner and founder of Inspyre Physical Medicine and Wellness.
My name is McKaylee, and I'm Inspyre's Client Services Specialist. Today we're going to be talking about regenerative medicine. Leanne is an expert in this field, and I have no expertise. So we're going to kind of see where the conversation leads about regenerative medicine. I know I have a lot of questions, and there's a lot of questions out there about what exactly regenerative medicine is and what it does and how beneficial, is it safe, and all the details we're going to dive into today. So I guess kind of go over what regenerative medicine is, give us a little explanation.
So regenerative medicine is being able to harness the body's own healing power and use it to help recover injuries, chronic pain, illness, things like that.
So what is kind of the number one regenerative medicine therapy is there?
So regenerative medicine is a broad field. There's a lot of different types are like under the umbrella of regenerative medicine. There's things like stem cells, there's PRP, there's exosomes, there's so many different, and then there's so many little subcategories under each one of those.
Explain why this topic is relevant for both medical professionals and everyday regular people.
Regenerative medicine is for like regular people, not for providers, but for people. It gives us hope of another way to help recover from injuries and maybe even diseases, less invasive, less reliant on medications and potential surgeries. For providers, it is a great opportunity or potential opportunity to help give our patients more options. Right now, with traditional medicine, we're very restricted on the things that we can and can't do and there's not a lot outside of medicine and surgeries that we can do, and so this regenerative therapies give us another range of options.
What makes regenerative medicine different from traditional medicine?
The difference between regenerative medicine and traditional medicine when it comes to orthopedic things. So you hurt your knee, you go to the doctor or a provider, they take an x-ray of your knee, and the x-rays look at certain things. Oh, it's not broken, and we're just going to wait 6 to 8 weeks and see how you feel, and if it doesn't feel any better, then we're going to go to physical therapy, and if that doesn't work, then we do an MRI. And traditional medicine is often led by insurance companies, what they will and won't pay for, and so you're kind of at their mercy.
It kind of sounds like you're just checking off the next one.
It
that
is.
Didn't work. Okay,
Yeah.
Next, what's next? That didn't work.
Exactly, because insurance companies, and so I like to look at it from a frame of they're there to protect the patient from unnecessary procedures and medications and also save money, right? Because if they just did everything that we wanted to do, they could possibly be spending a lot more money than what they need to. So I'm trying to put on my rose-colored glasses and pretend that that is the way that it is, but really it just puts such a roadblock, and the healing, so much healing, like abnormal healing, things that we don't want, formation of scar tissue and other things can happen during that time frame when we're waiting for insurance to pay for certain things. So that's your traditional kind of approach to injuries. Then if there's nothing, your x-ray's normal, you're still having pain, let's do physical therapy. Well, here's a pain medication, or let's do this injection, or none of that is helping, let's do surgery. And not saying that surgery doesn't have its place, it does. People do need surgery, but I just feel like we jump to it too soon, just like we jump to the medications. So we have a high rate of people addicted to pain medications because their pain is not being fixed with traditional treatments. So that's where regenerative medicine comes in. And there's different varying levels of it. So we have basic things like you come in, you have the same knee pain, we find out what happens, but usually there's a structural issue, whether it's above or below the joint. It's never, very seldom is it just the joint itself, right? Yeah. So then we do a whole approach. We have chiropractors and physical therapists that are looking at the whole thing and trying to fix that issue, correct the cause, right? And then using regenerative medicine, whether it's trigger point therapy, or PRP, stem cells, things like that, to help accelerate the healing and kind of break down scar tissue. Overall, it is invasive potentially, but it's not surgery, and then you don't have to rely on a medication every day. But we're also looking at the whole picture. How do we keep this from happening again? Sometimes you can't help it. It's just an injury. You had a car crash, you broke your leg, that kind of stuff. But usually it's overuse, postural issues, not controlling your health, like blood sugar, insulin levels, things like that that are really contributing to your chronic pain. And those things are often overlooked in traditional medicine.
Okay. So when you inject the PRP, like that specific treatment, what is happening inside the body?
So I like to use the analogy, or just like the knee as an example, just because it's easy to look at. We're right here, right? So draw your blood, isolate the healing components of it, and let's say you have arthritis in the knee or a ligament tear or something like that. We inject the plasma into that area. What it does is it signals your body that we have an injury. And then it sends all your own natural healing factors. So it just kind of puts a red flag right here. The best way to explain it is if you sprain your ankle swells, that's your body naturally sending healing factors to that area to repair that tissue. That process lasts anywhere from 5 to 14 days, depending on how bad the injury is and how good your blood is, I guess, how much regenerative power you have in your blood, if you will. So everybody's a little bit different, but that's your body's natural way of doing it. And then after it's done, if that ankle is not stable, then your neurologic system and the rest of your body has to stabilize that ankle. So it's going to start depositing scar tissue or start causing things to tighten up to protect the stability of that ankle. Well, that in turn can cause restrictions in your range of motion. So let's say your ankle heals, you never really have any issues, but then 2 years later, your knee starts hurting you. Well, that knee symptom, if you don't have any injuries, could be a result from your ankle. So that's why we look at the whole thing. I know I'm getting away from what we were talking about, but when we isolate the healing components of the blood, we draw your blood and we isolate those components, and we inject it, we have the same response as you did when you first sprain your ankle, and it does swelling, but you don't have the pain from the injury, right? And you don't have the swelling like that, but it sends a signal to your brain, we have an injury, please send guys to come down here and help. And so you kind of start that healing process over again. So you go down, and typically treatments can be anywhere from 1 treatment at a time, depending on how acute it is or how long you've had it. But usually it's a series of 3 different treatments, treatment injections, so a couple weeks apart. And that gives you 6 to 8 weeks of that robust healing to help possibly break down scar tissue, minimizing some of that range of motion, improving some of that range of motion, and helping healing damaged tissue.
So PRP, is it just an injection, or are there other ways like infusions to get it into the body?
Well, PRP is, it's just your plasma. It's in your body. It's already floating around doing as much healing as it can. The only time we use that is when we need to get into areas that need that more concentrated, robust response, and maybe the blood vessel isn't getting the blood flow that we want to that area. So it helps promote there. So it really wouldn't benefit you to take it out of your body and then just put it right back in systemically. Stem cells can be used not only in the joints or in smaller areas like that, but also infusions. They're being used now to help with just general wellness. So stem cells, like I was saying before, they don't really have a job. They're still looking to be told what to do. So the idea is if you infuse the stem cells along with exosomes are the signaling, particles that tell the stem cells, hey, you need to go here and do this and do that. So when you infuse those systemically, they can circulate throughout the body, complementing what your body already is doing. And so as we get older, we don't have as much of our own. It's a great way to complement that. And it'll circulate through the body and kind of find things that need to be fixed. So with those, they're considered more of a wellness infusion, saying so if you're having a knee pain, you're probably not going to get the benefit at the knee because it's systemically, right? Yeah. But you might feel that your energy levels are increased, or that they've seen it in autism, they've seen it in depression and anxiety. Just overall diabetes, it's really, there's a lot of studies showing this to help reverse diabetes even. Most recently we had a 53-year-old male that has a history of diabetes, high blood pressure, heart rate's usually 100, 105 just on average, has taken multiple medications to try to get that down, never comes down. Blood pressure is always 140s, 150s no matter what he does. Blood sugar is kind of controlled. A1C is around 6.7 even with his medications. He had a chronic plantar fasciitis that we've been trying to treat for over 1.5 years, and regardless of our normal treatments, we just could not get it to heal. He decided he wanted to do a wellness infusion of the stem cells and exosomes. that he did it on a Saturday, and within like 3 days, his heart rate was down to like the 80s. Blood sugar was a little bit more controlled. It wasn't perfect, but his like, even after eating on a weekend where he was binging and eating a lot, his blood sugar was only like 100, 120, when usually it would be like 180 and 200. So we're seeing just a little bit of control in that. And then since then, it's been about, I want to say it's been about 6 weeks since his infusion. We have him with a continuous glucose monitor. Blood sugar right now is running in the 70s.
Oh, wow.
Yes, his heart rate is still in the 70s and 80s. His blood pressure is slowly trending down. On average is about 130s right now, which is on the lower end of what it was before. So not huge, like, oh my God, he's cured, you know, but we're seeing some trends, some improvements in these diseases that he has. Oh, I forgot. He doesn't have any more foot pain.
Oh, the best part.
Yeah, I don't know why I keep. I'm like, oh my gosh, his blood sugar is so much more controlled, and I think we forgot about that when I was seeing him last time. I was just like, oh, by the way, how's your foot? And he's like,
haven't had any pain.
Yeah, he totally forgot about it too. He says every now and then when he walks, he might feel it here and there, but he's not walking with a limp. He is, you know, active. He's doing more at work and things like that. Just overall feeling better. And so, you know, can we say that the stem cells cured him of all that? No. But he is feeling better, doing a lot better. Another example of someone who's done well with the stem cell infusion is a 67-year-old female who has diabetes, high blood pressure. She's on several different diabetic medications. It's not controlled very well. Recently was in a traumatic injury involving her horse, to where she broke like several bones and just really kind of took her out of her normal active lifestyle. Then her beloved horse passed away, and then she lost her dog over like 14 years. So lots of like sadness and depression, in addition to pain and just overall not wanting to take care of herself anymore. She opted to do the stem cell infusions, and it's been about 4 weeks. She reports to us regularly, kind of give us some updates on how she's feeling. Blood sugar hasn't really changed. Blood pressure hasn't really changed for her. She says she never was in a lot of pain, but she didn't move a lot. But she is now saying that she is up riding her bike now. She actually just, I'm not gonna say ordered, but I guess is getting a new puppy that's gonna be ready in a couple of weeks. So she already doesn't move around a lot, and now all of a sudden is feeling so good that she wants a puppy, you know? And so I feel like her energy levels are better. Her husband says that she just seems more optimistic. So again, can we say it was the stem cells? Not specifically.
Yeah.
But, you know, 2 + 2. But overall, the goal for us is that she's feeling better and having a higher quality of life. So that's what I love about these treatment options. Alternatively, PRP. I mean, I'm trying to think of all my favorite cases, because we've done so many of them. One of my favorites was a nurse. She was attacked by a psych patient in the emergency room, injured her back, and had chronic back pain. And obviously you can't take pain medicines when you're working in the emergency room, like the ones that only would control our pain. And so she just dealt with a lot of back pain. Again, because she couldn't move, she gained a lot of weight, was feeling really bad. She also, funnily, she's a horse rider as well, so equestrian, and she wasn't able to ride because of her back pain was so bad. So she started off coming to see us for low back pain. We ended up doing PRP into the SI joints. She did physical therapy with that, and almost immediately was feeling better. And by about 6 weeks after her last injection, she was riding her horse again. And then she joined our healthy weight program, and we helped her lose the weight. So she lost about 60 pounds, riding her horse, got married, and now is having a baby. Yay! So lots of really exciting things. Her depression is gone because she was just so sad about everything. So can we say it was the PRP? Not specifically, but 2 + 2. So that's why I love these. There's so many other stories that I could tell you about, but the stuff works, you know. But it's not just the treatment itself; it's the overall treatment. Everything we do with that. That was physical therapy. That was weight loss. That was all of that, you know, all that together. So
just a real path to a healthier and pain-free you.
Yes, that's our goal.
Okay, so I guess then next question would kind of be like, why is regenerative medicine not more widespread? Like, why is the standard of care the traditional medicine instead of regenerative medicine when you can see so many more benefits from it?
Yeah, so even though it's, regenerative medicine as far as stem cells and stuff has been around for decades. I think the stem cell was first discovered, or I don't know if it's actually discovered, but that's when it got really big. The studies got big back in like the 1960s. And then in 90s is whenever, no, I'm sorry, let me rewind that. PRP was really big back in the 60s and 70s, and then now stem cells in the 2000s. Along with exosomes and things like that. My timeline might be a little off, but I'm just saying the point is it's been around for a while. The issue and the reason why it's not more used widespread is because the lack of studies that can produce consistent results so that they can be approved by the FDA. So basically the gold standard for any treatment, I guess if you will, in traditional medicine is FDA approval. So most medications that we take are FDA approved. But because there's not a lot of people putting money into the trials that need these to be done to be FDA approved, and they're so expensive. And the other issue is there's so much variability. It's hard to produce the same results time after time after time because we're getting products from humans, from yourself.
Yeah.
And it's hard, you're different than me. So even if I put a 56-year-old male and a 56-year-old male together and we did the same exact treatment for the same exact problem, their body is not the same.
No.
So they're not going to start off with the same levels of platelets. And there's just so much variability. So that's what makes it challenging in research, especially when you're looking for like a standardized treatment like that. There are lots of studies done that show there's benefits. There's lots of them. You go and find all kinds of information about that. Most of regenerative medicine, what we hear is there doesn't seem to be any harm. We can't say that that's the reason why they improved.
Yeah.
So therefore, some providers are taking the stance of just making sure their patients are fully educated on the risk versus benefits, and then saying, are you willing to take the risks for this potential outcome? And most of the time the answer is yes, and a lot of the time we have really good results, and I'm not saying it fixes everybody, but we have a really good track record.
Is the answer most of the time yes because the risks are, I don't want to say non-existent, but very minimal? Like, is this the good outweigh the bad? So the risks versus the potential outcomes, are the risks so low that patients are like, yeah, let's do this. Like, why haven't we started already?
Right. Again, because we don't have enough data to show consistently especially the long-term risks. We know that the short-term benefits are worth the short-term risks. So for example, bleeding into the joint or infection, things like that, possible reaction to stem cells or something like that. But it's the long-term data that we don't have. And so it's easy to say we don't know, or that there's minimal risks, but we don't know what's going to happen in 10 and 20 years. So when you're giving someone something that could generate cellular development or growth, or healing, like I said, they don't pick which cells they're going to, you can't tell them to become certain cells, so you don't know what they're going to do. So they have the potential to likely turn into a tumor, or grow something that we don't want to grow, things like that. And so we just don't have enough data to feel comfortable saying that this is not going to happen or this is likely to happen. So the patients have to go, is my quality of life something that's worth this potential unknown consequences?
What does the future of regenerative medicine, in your opinion, look like to you?
We need to get someone really rich to help push the studies and consistently. Like, if it's completely my opinion, I think we don't mind investing money into medications and things like that to help people manage their symptoms, but we're not putting the money into things that could potentially fix them, because I don't think that big pharma would make a lot of money off of products that you get from yourself, or, like we said, from the placenta or the umbilical cord. I just don't think there's enough money for the people who are willing to invest their return of investment, I guess. So I feel like now, though, your generation is different than mine. So your generation and younger, they're not just accepting the fact that, oh, you have to take a medicine, do this. That's why you're seeing this boom of like wellness centers and things like that, and people working on this lifestyle modifications, because you're understanding and you're not just willing to sit down and just take what people tell you, oh, just take a pill for this, just do that, you'll be fine, suck it up kind of thing. You're not taking no for an answer, and that's what I love. So I love talking to the younger generation because they're easier to absorb it. They're willing to say, you know, if I tell them to exercise, they're like, okay, I see the benefit of that, right?
Yeah.
Whereas my generation, we're like, I don't have time for that. That's not what they told me I needed to do when I was younger. And so, you know, it's just harder to break down the barriers that we've been taught like our whole life. Imagine trying to tell a 70 or 80-year-old person that they don't have to, that it's okay to eat carbs and that they need to exercise and they'll feel better. Like, you know, so
Yeah.
it just, I love that. So that's why I guess the point of that is like this generation, I think, is spurring the questions. They're asking the questions, they're demanding more. And I think along with that, we'll see an improvement in our food systems, in our medical systems, and I'm excited for that.
How soon do you think like these advances in the future would come along?
I would hope within the next 50 years. I know that sounds like a long time, but my children were all just born and now they're grown, so time flies. So like before we know it, we'll have something like this. But unfortunately, trials to show long-term, you know, safety are 4, 6, 10, and 20 years, you know, somewhere in that range. And so depending on what they're looking at as to how long before that study is, you know, blessed and said, okay, this seems to be safe kind of thing. So even if we just had one study going, it would be a minimum, I would say, comfortably 10 years. But that's if more people were wanting to spend the time and the money to do the trials.
Yeah. Okay. How do you see regenerative medicine changing the future for the average healthcare patient?
I see regenerative medicine, like we said earlier, is if we can steer in that direction and using more natural, less invasive approaches to repair and regeneration, that's it. I feel like if we can focus on more natural things, and then like I said, your generation right now is more worried about how do I prevent this from happening. I'm hoping we see a shift in prevention. We don't have to worry about this so much, right? People are taking better care of themselves. We're eating better. Our food sources are better. You know, like the water quality is better, and I think that's going to take a huge push. But even having those options, but having the option to do regenerative therapy instead of surgeries and daily medications, I think is going to really just, I don't know, I feel like I'm rambling, but I just feel like it would just change the world. I think that if we could just get the government or the FDA on our side and help push these things, I think we would see a huge difference in the health of our culture and our communities. What kind of questions, like you, in regards to like thinking about yourself and your family and your friends and knowing what you know and working with me here, do you have any questions about how any of this can be used to help you or someone you know? It's okay if the answer is no,
Yeah,
you know, but just cut that part out. But
No, I don't think my question is what you're wanting. I think my biggest question is to everybody else, like, why don't y'all come here? Like, we do everything and it's great, and I see all the patients with like the potential benefits and them coming and getting their treatment and getting better, and then sometimes we don't see them anymore after that, which is sad but good because we healed them and they're great. I definitely think the question, if I would have one, would be like, would there be any benefit to me, who's pretty much healthy, getting any of these treatments? Like, is this the type of treatment that you only get when you're at your last, or is this something that, like you said, could be preventative? Like, I rolled my ankle a couple weeks ago. It's pretty much fine. It doesn't really hurt. I haven't worn heels though. Like, I haven't been able to wear heels without it hurting. Is that something that I could get PRP for?
that is a great question, and that's a great example. Is like we traditionally wait until we have something that affects our quality of life, and then we go seek treatment. So I would like to see if you have, for some reason, if you keep rolling your ankle, why do you keep rolling it, right? Is it the fact that you're always wearing heels, or is it the fact, like, is it, an environmental thing, or do you have ankle instability issues, right? So if your ankle is unstable and you keep rolling it, let's stabilize the ankle. Let's do some physical therapy. Let's find out what it is. So that would lead us. That would be the first step, is like looking at you to see why is your ankle unstable, right? Some people are just clumsy. Some people just wear the wrong shoes. That could be it, and that might be the problem. But if you're not able to do the things you were able to do before, like wear heels or do certain activities, that's a problem.
Yeah.
And it's not really a big problem right now, but what if it is later on in your life? Then you start having knee pain. You may not realize that if you have limited range of motion in your ankle, then you start having knee pain. Well, why is my knee hurting? Well, it's because your ankle has modified your walk and things like that. So the answer is yes and no. Like, I wouldn't start with it. I would do a good exam. I would get you with the physical therapist. We would help identify any potential areas that need to be strengthened. And then if that's the case, we may do PRP just to help kind of improve your range of motion. Those smaller joints have pretty decent blood circulation, so they usually heal pretty well. But I've done ankles several times in patients that kept rolling them and they come out with great. As a matter of fact, I know this wasn't the time for that, but I had a young girl. She was 14 or 15 and she kept rolling her ankle, volleyball player. She kept going down, rolling it, and then she would always have pain, and she kept getting put in ankle braces to support the ankle. Well, that's an external support. That is not fixing the problem. So we ended up bringing her in, doing physical therapy and PRP. Her ankle got so much better and stronger that she doesn't need the brace anymore, that she rolled her other ankle one time and came in and immediately had treatment. Now she is in high school, already has a contract with the college to play when she gets out of school. So was it because of the PRP? No, because obviously if she wasn't good at what she did, she wouldn't be able to do it. But she was being affected by that ankle instability, and we worked with her to help fix that so she can move forward. So I know that wasn't the question for like that, but these things just pop into my head. But I think yes and no, like I said, to answer your question but it's not just about the PRP, it's the whole picture.
Yeah.
And I think even other places that do regenerative medicine may or may not have in-house
Everything.
team, right? Because they'll write a prescription for physical therapy and you go and you don't really know who you're going to, and if you'll get the same therapist each time, or what their therapist is like, what their mission is. Like our therapists, we have several, but we have one that likes to really focus on runners. So she's going to have a lot more expertise in running. And so somebody who is Olympic weightlifting probably needs a different type of guidance and stuff. So anyways, we tailor that. And I think that's what's important. So I don't know if I got off track, but if that answered your question or not.
Oh yeah, that's good.
But overall, I think that, regenerative medicine is the direction that we're going. It's just going to take us some time to get there. At Inspyre, we are doing the best that we can to really harness that power and empower our patients to realize that the potential for them to feel better and heal is within themselves, and we just want to educate them and teach them how to do that.
So we're about done, so why don't you give us some of your final thoughts about everything we've talked about?
So final thoughts about regenerative medicine is it's definitely the wave of the future, and I can't wait to see where it goes, and I really want to be part of that. And I think the biggest thing is to understand that you have the power to heal yourself, and we just don't know how to do that. And so whether it's regenerative medicine or PRP, stem cells, whatever it is, I think the most important thing is you take the time to realize that you're not stuck. You're not stuck in pain. There are alternative ways, and if you're not sure if it's right for you, I guess I'm talking to you guys, if you're not sure if it's right for you, talk to your primary care doctor. They may know somebody if you're not in the Houston area, but if you're in Houston and you want to talk some more and see if it's something that is right for you, give us a call or text us, check out our website, and let us know what kind of questions you have. Bye.
Feel better, live better.
And then